Okay, so the next in our series of Encoder references is going to be the clinical pharmacology drug reference. So, again, when you get into 3M and as you're coding, here's what your screen's going to look like, very similar. And let's click on our little book stack for our references. And the clinical pharmacology drug reference is going to be found in the 3M coding reference. So let's click on that right here. This is what we're going to see. So again, the most efficient way, we could look it up by, clicking the first letter of the name of the drug, but that's not really efficient. So let's be efficient and click on our little binoculars, and we get a search for pop-up window. So let's search for, let's search for vancomycin. All right, so here we have what comes up. Here's our search results, and you could have many, many, many things here. But what we have here is first vancomycin and vancomycin. View adult monograph for both and view pediatric monograph. So we're dealing right now, let's just say we're dealing with an adult, and we don't know what first vancomycin, what they're talking about. So let's just look at the generic one, vancomycin. All right. And it gives us a picture of it, and as we can see, this is not a pill, it's not oral. It tells us right here it is an injectable. It's vancomycin hydrochloride powder for injection. All right. If you really are curious, you could click here and look at more pictures, and here we do see that there is a capsule form. All right. Here we see there's more injection, more capsules. So that's telling us that, we could have it in a capsule, but perhaps the most common is the injectable. So now, how do we get back? We come up here to our little blue arrow, and we click that, takes us back. So here we have all of our monograph information, pharmacokinetics, oral route, peritoneal route, etc. But what we really are interested in are things like adverse reactions, interactions with other drugs, dosages and indications, contraindications and precautions, administration. Now, when we're looking at indications and dosages, we're going to click on that, and here's a ton. So these are all reasons that you could give vancomycin, or that you may see a patient receiving vancomycin. And there's a lot here, and you'll notice they are all infections. All right. So let's say we wanted to know more about giving it for brain abscess. So let's click on that. This gives us all of the information that we would need about giving vancomycin for for treatment of brain abscess. All right, it gives the dosages, so you can see here, for instance, neonates, post-natal age, 7 days, etc. Manufacturer recommends an initial dose of 15 milligrams per kilogram IV, then 10 milligrams per kilogram IV every 12 hours. Okay, that gives you an indication. If you see that kind of a dosage being given to a child, then probably they're doing it for a brain abscess. It's very possible. But at the very least, you know that it is necessary. It's being given for an infection of some sort. Okay? Same thing, we have skin and skin structure infections. So let's look at adults. There's no standard continuous infusion dose. It gives you different studies, so different things that you may see. All right, so let's click back, and we're going to go back one more time, and we're going to go back up here. Here we have interactions and adverse reactions. Now, let's think about why that might be important. So what if you have a patient who's suddenly has a strange diagnosis pop up in their record that doesn't fit with what's happening with them for the rest of the time? What you can do is you can say, maybe that particular diagnosis could be an adverse reaction or an interaction with a medication that we gave. So you can click on adverse reactions and it will give you all of these reasons that could be adverse reactions. So maybe you have a patient who's in for I don't know, maybe they're in for something that doesn't have anything to do, maybe they're in for a skin infection, and suddenly they're 30 years old, and suddenly 5 days into their inpatient visit they go into cardiac arrest. Well, that's, and there were no symptoms. If you click on cardiac arrest here, it will give you an explanation for that. So here it says rapid infusion of vancomycin can cause histamine release. This histamine release reaction is often referred to as the red man syndrome and is characterized by flushing of the face, neck, upper body, arms, and or back. This may result in an anaphylactoid reactions including hypotension, sinus tachycardia, wheezing, dyspnea, urticaria, erythema, pruritus, and rarely cardiac arrest. Rapid infusion may also cause pain and muscle spasms of the chest and back or paresthesias. Symptoms usually resolve within 20 minutes but may last for several hours. Stopping or slowing the infusion rates may reduce the incidence of severity of the reaction. Phlebitis, vasculitis, and other types of injection site reaction have also been reported. This type of reaction has also been reported with the use of oral vancomycin. The incidence of hypotension was higher in patients that were, oh gosh, I never know my greater than and less than. I think that's less than 65 years of age during oral vancomycin trials. So that's telling you that, you could have cardiac arrest due to that, and maybe that's why. What I would say is, I would look for some of these other issues. Do they have red man syndrome? Is there sinus tachycardia, weeping, dyspnea, urticaria? And then we have that cardiac arrest. That may be telling you that the cardiac arrest was due to an adverse reaction due to the vancomycin. So it's a way for you to locate some extra information there, help you decide perhaps if you have an adverse reaction, if you don't. If you have an adverse reaction, then we have a hack, right? We have a hospital acquired condition which is then not coded. That will tell you right there, don't code your POA as Y. That was not present on admission. We did it to them. Therefore, we have to report it as such. You'll also have E-codes, correct, for your cause. All right. Same thing with interactions. This gives you interactions, only it gives it to you from a pharmacologic standpoint. So all of these drugs have interactions with that particular medication, with vancomycin, potentially. So it gives you a lot of really good information there that you might find useful when you're coding a patient's chart. That concludes the clinical pharmacology and drug reference.